Prof. Özçakar, it's an absolute pleasure to have you as a guest faculty here in our BSPRM MSK course in Leeds. You don't need any introduction in the world of PRM, of course. So I'm not going to talk through all the hats you carry and all of your great achievements. I think what I would like to hear is that what's your impression of our course so far?
Thank you. Thank you. I mean, those words are enough explanatory. So it's my great pleasure and honor to be back in UK. And this is the course that I'm actually attending for the first time. I'm trying to join, try to contribute as well. But of course, organized by the close friends of ours in PRM Society. That's a great course. I knew that it was organized before. I think this is the fifth time.
This is the fifth time that we're doing it, correct?
But unfortunately, this is my first time attending to it. So it's I see that many of the youngsters are quite enthusiastic about MSK. And I also try to understand how you try to compensate for the lack of sort of MSK education in your perhaps curriculum in PRM residency. So it's my great honor and pleasure to be back.
Thank you very much.
This occasion.
That leads to my second question, really. As you have noticed, that the fundamentals of the MSK, that's what we're trying to build up in the specialty of rehab medicine in the UK. And unfortunately, we are a bit limited in our practice areas and also in training opportunities within our specialty. As a pioneer in MSK rehab and ultrasound and so many other PRM subjects, what would be your advice for us that how we could improve that situation and expand the specialty and the workforce?
Yeah, thanks. That's, I think, a challenging, important, but also a challenging question for your specialty, for your society, for our specialty in UK. I mean, let me openly say that I was a little disappointed, actually, because, okay, I knew that MSK was perhaps a little undervalued, not related with the colleagues, but perhaps it's the culture of rehab medicine in UK. Another disappointment is actually related with some non-PRM doctors trying to take over that MSK issue. I think these courses are initially a good start for these, recovery, let's say. And I would say from the ISPRM side, I mean, just also representing ISPRM, some of the countries in other parts of the world are quite advantages for this discussion. UK is a little disadvantageous, and you try to compensate for this. And getting collaboration from other countries who are doing this MSK side of our specialty perhaps would definitely help. So I would suggest collaborations with countries or organizations. In this case, ISPRM would definitely be willing to help. And we have already well-established study groups, interest groups, task forces, and perhaps joining those groups within the umbrella of ISPRM would definitely help from ISPRM side. But on the other hand, you can get also support for individual countries and individual societies where MSK practice is well established. And I would say perhaps within Europe, this is more southern European regions, not northern parts, but more southern parts, but in different countries also in different parts of the world, in Americas, in Asia and Oceania, that could be also nice alternatives to collaborate with. I mean, in Turkish, we say 1 + 1 is 11. If you have a nice and good and strategic collaboration, so you can make 1 + 1 + 1 already 111. That could be my just 2 cents.
Your presence here in our national course signifies our enthusiasm in that international collaboration, I hope. Then your presence also has driven lots of international candidates this year, which is a change. We're very happy about that because we know that we learn from each other. And although the systems, the culture, the needs of the society could be different, there's no getting away from MSK, isn't it?
Yeah.
There's MSK in everything, regardless of which area of the specialty you're dealing with. You could choose to go pure MSK, of course, but in the UK, we're much very aware of the need of having the fundamentals, of perhaps building a bit more advanced. So we're very pleased to have you as a faculty member and a collaborator here. Another thing which could be very exciting for our society members and for our trainees, that EURO-MUSCULUS.
Yeah.
There's talk in the air that EURO-MUSCULUS might be coming to the...
Yeah, we say inshallah. Why not? Because that is actually our study group, working group, or whatever you name it. It's not within any ESPRM or ISPRM official organization, but that was, for many years, we've been doing these courses. Initially in Belgium and Turkey, then we started, why don't we go to all other European countries as well? In this case, of course, we're talking about EURO-MUSCULUS, but we have the World Musculus, we go outside Europe. Yeah, with our colleagues, with our kind friends, they were very enthusiastic and they were very ambitious to invite and host EURO-MUSCULUS in 2027, because 2026 is already being planned in Rome. So we say tutte le strade portano, or not Roma, but ecografia. So we're expecting all the people this year in Rome, but next year, Malta a little appeared to compete, but then we said, okay, after Rome, going to Malta perhaps would be a little less reasonable when compared with coming to UK, where we would like to really support MSK. And once you say MSK, not just MSK, in all rehab medicine, you cannot talk anything without ultrasound. I'm totally biased, of course, but so organizing EURO-MUSCULUS, I think, would be also a good, not initiative, but could be a good significant landmark in the history of PRM in UK, and that would be again our great pleasure and honor. We are so humbled.
Very thrilled that we are able to make that collaboration with EURO-MUSCULUS, and salute to our Maltese colleagues, which we also have good collaborations with. But 2027, EURO-MUSCULUS will be in the UK, and everyone should watch the space for it. And I think it wouldn't be just learning about ultrasound, isn't it? It would be learning about your approach that now you spread around internationally, that it's a part of our clinical examination, it's part of our holistic review. So
yeah, just to a little, give information about the course. This is usually a 3-day course, and we have 2 simultaneous courses actually. The ones we do in ISPRM, we call them USPRM, but we do them like 2 days. But here in EURO-MUSCULUS, we have the beginner and the advanced, and both are simultaneous 3-day courses. And colleagues from UK or from any other parts of Europe or the world, not just Europe, are very welcome. They need to mark their agenda in advance. The 2027, probably in October and November, we will be organizing EURO-MUSCULUS in UK for the first time in PRM history.
So thank you very much. I'm sure everyone's thrilled to hear about that amazing news as well. We're going to continue enjoying the course, hopefully. We've got a workshop to run and some lectures, and we're carrying on in the work. So thank you very much.
My pleasure.